Markel, I hope I'm pronouncing that right, is the Distinguished Professor of the History of Medicine and Director of the Center for the History of Medicine at the University of Michigan School of Public Health. Did I get that right?
University of Michigan Medical School.
University of Michigan Medical School. Thank you. You have a very long bio.
Thank you very much, Isaac. Good to see you.
You were the lead author on a paper about 13 years ago, more than a dozen years ago, about the flu pandemic of just over 100 years ago, 1918, 1919. Which has some interesting insights into things like social distancing and flattening the curve, two phrases we've become very familiar with. So before we talk about coronavirus, talk a little bit about that paper and what you learned from it.
It was right after the bird flu scare of 2005, 2006. Great amount of conversations were being held of what would we do if a worst case scenario occurred vis-a-vis bird flu. Well, the worst case scenario on the books happens to be the influenza pandemic of 1918, 1919. It is the largest database of this menu of social distancing, specifically quarantine and isolation, school closure, and public gathering ban.
So you write among the 43 cities, which you just referred to here, that we investigated, neither the city's population size, density, sex distribution, nor age distribution accounted for the differences in mortality. So then what were the differences?
We could measure week by week from September 1st to about April 1st, how many deaths and cases there were in each city. And we simply saw, as I said, fewer deaths in those cities that did early, layered, and sustained NPIs, non-pharmaceutical interventions. When the social distancing measures were on, flu deaths went down. When they were off, they went back up again. So it's actually very germane to the current situation today where there's been talk of releasing the triggers, releasing the social distancing measures in a week or so when Easter comes.
Did people at the time have some sense that they had done things that, flatten the curve, so to speak? Was there some sense of, success, or was the sort of way that the epidemic was popularly looked at in the public consciousness, even right after, that this was just an unmitigated disaster and there was no way to do anything about it?
This coincides with the end of World War I. There was a lot of can-do spirit. There was a lot of patriotism. And a lot of the public health announcements and suggestions were conflated with patriotism. So people who didn't wear face masks in San Francisco were called slackers. People who did not do their part and went to bars or went to the theater or what have you, they were looked upon as not helping the situation. Now, the thing about a pandemic then as now, when you're in the middle of it, you're literally in the fog of war. You can't see all the results and you don't have all the data, but the newspapers were filled with influenza material during the pandemic, just like our current newspapers today. So you had a crude measure of were the numbers going up or were they going down? And I think people follow that pretty closely.
One of the sort of paradoxes of something like coronavirus and maybe the flu pandemic too is that, you had a situation several weeks ago where people were going down to spring break to party in Miami, and there was less kind of social pressure of the type that you're talking about World War I, to call people slackers or to, get their act together until things get really bad. And by the time things have gotten really bad, then it's too late and the pandemic is spread. It feels like it didn't build up this time around until things may have been too late.
I've had the surreal, almost Twilight Zone experience of living in my own history books. It's a very odd feeling. It's almost like human nature to not think about a disaster until it's right in front of your face. As the father of two young, not so young, a 19-year-old and a 15-year-old, they're used to their dad talking about pandemics, so they weren't going on any wild spring breaks. But I must tell you, when I saw that video, I was aghast. What in God's name are you doing?
If I get corona, I get corona. At the end of the day, I'm not going to let it stop me from partying.
I think now, I doubt there's as much spring break activity today as there was a few weeks ago. Or people, health officers who do it. I'm sorry. Sorry, it's my daughter.
She's calling from spring break, yeah. there was definitely kind of a tipping point where I think that people started to really take it seriously, which of course is good, but by then you wish some of the measures had been in place before then. But again, you can't get them in place because people don't take it seriously because not that many people have died.
And you can never really do this too early. The problem is that history is littered with public health officers who took these measures too early, and then everyone complains, we're losing money, this isn't fun, etc. A lot of behavioral psychologists have noted is that you probably only have one chance to impress upon a citizenry that you're going to do these measures, and to try to do them 2 or 3 or 4 times in rapid succession may not work all that well. People may not listen. They may feel that you're crying wolf or you're Chicken Little. And so we have to do it for a period that's lengthy. That's the problem. And we won't know when it's over until long after it's over. So it's hard to know when to release the trigger. The key word about this coronavirus is novel. We don't have any experience with COVID-19. We don't have any data from last year that we can compare it to. So we are flying by the seat of our pants. But this I know, if we release these measures too early, we're going to be back in the same situation that we were in terms of cases and deaths, or perhaps worse. And we will have crippled the economy and caused all this social disruption for nothing. So I think we have to stay the course now that we're in it.